Good afternoon, everybody, and welcome. Welcome to this week's COVID-19 campus briefing. Thank you all for joining us. I want to point out that live captioning is available and that a recording of this session will be posted later today. Today we'll be going to 2 p.m., so hopefully we'll be able to get to lots of questions. I'd like to introduce this week's participants and speak a little bit about our agenda. We're joined as always by Provost Collins, Vice President for Student Life, Harmon, our Campus Chief Health Officer, Dr. Preeti Malani, and each of them will give brief updates in a moment. Dr. Rob Ernst and Professor Emily Martin from our School of Public Health will present updates on our dashboard, response metrics and actions, along with plans for updating the community on the status of metrics. We've gathered questions that have come in from the community this week, and so we'll answer some of those, as well as those that come in today during the discussion. And I'd like to point out that many of the questions we received last week but didn't have time to get to are now posted up on the Maize and Blue website and also on the President's website as well. So thank you very much for providing those questions. So first, I'll turn it over to Dr. Malani to give an update on campus conditions.
Thank you, Mark. So it's been a great week. We're exactly halfway through the in-person portion of the fall semester, 6 weeks down, 6 to go. COVID cases have been lower the last couple of weeks, quite a bit lower. 2 weeks ago, we hit a high of 278 cases. And there was a lot of work that went into talking about prevention and decreasing risks, especially among the fraternity sorority life leadership. And last week, the numbers were better at 144. And this week, so far, we're at 59. And I want to note that 24 of those cases were added this morning. So in general, I think we're going in the right direction. And Dr. Martin will talk a little bit about the fact that the county is also going in the right direction. So thank you, everyone, for your efforts to stay safe and to keep others safe. As in previous weeks, case investigation has identified some clusters of infections in some of the residence halls. And like with the prior clusters, some of these cases, most of these cases, in fact, they share a social connection or close contact with someone who has previously tested positive. Once again, pop-up testing was brought to these sites, and students living in the affected areas were given information on where and when to get tested. This went quite well overall. There are about 700 tests that got done this week with 13 positives, so right around 1 to 2%. We continue to worry about the residence halls and other congregate settings, fraternities, sororities, co-ops, even large houses, as places where transmissions could really take off. But what we are seeing with each passing week, and we're learning as we go, is that it is the social gatherings that are risk factors, not simply living in these settings. And the pop-up testing gives us more evidence to support this belief. As I've shared previously, we are not seeing spread in the classroom or other public areas, which is great news. So keep wearing a mask, keep watching your distance, and try to avoid the large gatherings, especially indoors. I want to encourage everyone to use the Responsa Blue daily symptom tracker. Uptake has been lower than we would like. It takes about 2 seconds, and this information is helpful for us monitoring campus. The testing and surveillance program, the community sampling and tracking program that Dr. Martin and Dr. Ernst will talk about is adapting. Some of you saw the notice in the record this morning. It's going to be more convenient, and we're going to have capacity of up to 6,000 per week. We'll talk a little bit more about that during the discussion, but one of the big changes is that we'll be moving to a saliva-based collection method instead of nasal swabs, and there'll be sites across campus, so please sign up. I'm going to make my weekly plug for University Health Service. The team there last week did more than 600 tests on students with symptoms. Getting tested on campus means the results come back faster, and most importantly, it means that you can get the full supports you might need. And this is helpful, not just for you, but really for the entire community. I do want to acknowledge that sometimes things don't go perfectly, whether it's at the health service or quarantine housing or the COVID hotline. All of this is a work in progress. Things change. We're striving to improve based on feedback, and just thank you everyone for your patience. We talk a lot about COVID, but I want to put on my parent hat for a moment and just touch on academics. It's midterm time. We're going to hear more about this from Provost Collins, but academics are often a huge step up especially for our first-year students. It's stressful. I would just advise you to manage your time carefully, reach out to your professors if you need help, go to the review sessions. There are great resources across campus, Two of my favorites are the Sweetland Center for Writing and the Math Lab. They have virtual appointments. Because of limits on numbers, it might be harder to find spaces to study on campus, but you can reserve spots in the unions and the libraries. Sometimes the bigness of Michigan can make it hard to just find your people. And I imagine that it's probably harder this year. So check out the Center for Campus Involvement, join a club or group so that Michigan feels more like home. Rec Sports reopened their buildings last week. It's gone really well. You can make reservations online for a variety of workouts. And you just need to look out the window and see it's a beautiful time in Ann Arbor. Go for a walk in the Arb, go play in the wave field, go lay in your hammock, go to the museum, find ways to get outside every day and connect. I do want to acknowledge that this is also a difficult time. Some of us are having a harder time than others dealing with disruption in every aspect of our lives. We as a community feel sadness and grief, and there's not a simple way to make all of this go away, but there are people here to help you adjust. Some helpful options that I want to make you aware of are wellness coaching through Wolverine Wellness, as well as the counseling service. Many of the academic units have embedded counselors and other people to support you. And for students and parents, you know, there are no wrong doors. So if you can't figure out where to get help, email me and I'll help you. We talked about this a lot in the spring, and I'm going to say it together. We're all in this together. Let's keep that in mind as we march onward. 6 more weeks till the Thanksgiving break. Wear your mask. Find ways to stay connected with your friends. Study hard, make good decisions, and stay safe.
Thanks, Preeti. You know, I had my first screening COVID test this week too, and being curious, I tried both the nasal swab and the saliva test. They're fast, they're easy. The saliva is particularly easy. Palmer Commons is where I got mine, and I got my results soon thereafter, and I'm negative, so that's good. I next turn to Provost Collins, please.
Great, thank you very much, Mark. And I'm actually going to build on some of the comments that Preeti said towards the end of her remarks. I'm going to use most of my time to focus on the added stress and anxiety in the current context. So many of you are really grappling with teaching, with learning, with getting research done, with getting work done. It's a lot harder in a variety of different ways. And I think it's important to acknowledge that and also to provide some information. And again, I'm building on some of the things that you've just heard about some of the resources that are available to help. Please do reach out and ask for help. Let me just start with our students. As we move into mid-October, the pace often picks up. You have midterms, there are mid-semester projects. That can be really stressful in a normal semester, and of course this really is not a normal semester. So for many, it's really important to find a safe, quiet, comfortable place to study, to do your work, and a change of venue. I know a number of students are really spending a lot of time in the same place, and then that can be challenging as well. So we've developed a new tool that I want to make sure that you're aware of called Study Spaces at U of M. It's an online tool, and it helps you find and reserve designated study spaces, computer stations, a place to do a remote class, just a dedicated quiet place to touch down on campus. It currently has over 1,400 individual spaces that can be reserved on North Campus and on Central Campus. All of the spaces are socially distanced. They have disinfectant materials that align with public health guidelines. And we really hope that you'll use this new tool and encourage you to try some new spots across campus. That can be really kind of relaxing and empowering and helpful for your work as well. More generally, there are many supports available for our students. Just to mention a few additional ones, we have added additional CAPS counselors as an exception to the hiring freeze to support our students. CAPS also has a number of meaningful programs and educational materials on their website. We know that many of our students are remote, whether in Ann Arbor or elsewhere in the country or in other countries, and often in different time zones. And so we'd like to highlight the Silver Cloud as a resource, which is available, can be accessed 24/7. Silver Cloud is an online self-guided interactive wellness resource. So that's not a substitute for in-person mental health treatment and support, but it can be helpful as a resource to students who are grappling with stress and anxiety. We also know that pressures on our faculty and our staff are extensive and significant. And so I wanted to, again, just point out a few resources. FASCO offers confidential tele-video sessions and phone appointments for staff and for faculty. We also encourage you to visit their website to learn about services. They have newly developed programs in the current context. Just as one example, they have virtual discussion groups, which can really help to address the isolation that I know some are feeling across campus. And this is a particularly anxious time for our tenure track assistant professors. So I know that faculty at all levels are under tremendous stress, but I'm particularly concerned about our junior faculty on the tenure track, especially those who are navigating childcare, homeschooling, dependent care. Data across higher education shows that while some faculty are able to be more productive, working at home in the current context tends to exacerbate disparities, especially for our female faculty and our faculty of color. So we will be exploring ways to address these concerns, but I wanted to highlight that yesterday at the all chairs meeting, President Schlissel and I asked the chairs to encourage our junior faculty who are dealing with research disruptions to request a clock extension using our existing policies. It should be easy and it should be encouraged, no stigma. So I'd like to encourage our junior faculty to take advantage of this option as well. Finally, and shifting gears a bit, Mark and I will soon be meeting twice a month with a faculty COVID-19 council that SACUA is creating for us. The council will bring forth ideas, discuss concerns, consult and advise on issues that arise from the pandemic and its effects on campus. SACUA is accepting nominations through this Monday, October 12th. So I'm going to end by encouraging our faculty to consider submitting a nomination, including self-nominations, to serve on the Faculty COVID-19 Council. Thank you.
Thanks very much, Provost Collins. I next call upon Vice President of Student Life, Martino Harmon.
Thank you, President Schlissel. Along with the theme of well-being, I want to just touch on engagement opportunities for students. We know a lot of students are looking eagerly for ways that they can connect and engage with others. It's critical that we provide opportunities for students to get involved and get connected so that they don't feel isolated and lonely. Although our staff will continue to reach out, I'm really encouraging students to visit at least one of the variety of student life or university websites to check out the vast array of options that are available, which include virtual and safe in-person distance activities. The Happenings at Michigan page is a good place to start. Just type in events.umich.edu. I also encourage students to visit the Get Involved page on studentlife.umich.edu to learn how you can get involved with some of our over 1,400 student organizations. To get regular updates about student organization involvement, check out the Center for Campus Involvement, or CCI, their Facebook page, Instagram, they're out there. So make sure you check that out so you can join a group and get connected. Just take the first step in joining something and getting involved in something. So just a few quick examples of weekly themed programs with the university unions. This past week was a virtual trivia, safely distanced hangout at the ARB. Just recently learned what that meant. Register for Taking Care of Maze and You, an event which allows you to make friends, practice self-care, and participate in various different games. Volunteer at the Ginsberg Center with some of your friends, so don't do it alone. And participate in other events such as Arab Awareness Month, Coming Out Day, and other events can be found on the Happenings at the University of Michigan page. We're working on adding more creative, safe, in-person, coordinated activities to participate in. Student life leaders, in collaboration with academic affairs, are exploring additional community events that comply with public health guidance. So please take a look out for that, and we're working hard on that. And this really leads to my next update, which is about football and risk management around football-related activities. So many of you are thinking about football starting in a few short weeks. This will be my first football season, so I'm excited. But we also see this as an opportunity to bring students together in a safe way. The University High Risk Planning Committee is hard at work focusing on three primary areas. One, planning a variety of safe, small student gatherings that will allow for connections and opportunities for students to including public health informed in-person and virtual events. 2, communicating and reinforcing strong public health messaging, COVID safety, connections, alcohol harm prevention, and civility. And 3, accountability efforts for maintaining policy and ordinance expectations. Along with virtual options being planned is a second screen opportunity for engaging students with the football games and athletic traditions before and during and after games. I'm excited about exploring those. Second screen, if you don't know, refers to when you use a mobile device to access supplementary content or applications to enhance your viewing experience. As part of this, we're exploring a variety of alternative options for students not participating in football or general sports activities. Whether you're someone who just can't wait to yell, "Touchdown Michigan," or you're someone who enjoys spending Saturdays doing other fun activities, we've designed a variety of different options. And my final update is around accountability and compliance and safety measures in university housing. We made some changes thanks to ongoing conversations with RAs and diversity peer educators that really will benefit our whole community. And I've enjoyed talking on a regular basis with those student employees. A few specific enhancements include hundreds of additional disposable masks have been given to those communities. Priority status for weekly surveillance testing is available, particularly for our res staff members and also dining student employees. And then more detailed information about positive cases in the hall and tightening up our conduct system. For students in university housing, we're holding ourselves and you accountable. We expect you to hold yourselves and your peers accountable. Safety is a community responsibility. And I want to be 100% transparent as I close. Not all students are taking this seriously. So unfortunately, we've had to terminate a few housing contracts because of that. Clearly, not all of our students are engaging in unsafe behaviors, but we're taking every instance seriously, and we're really trying to tighten things up. Non-compliance with safe behavior, really, we just can't tolerate it. It's critically important. So I'm proud that we've made it this far. We must hold ourselves and others accountable, both inside and outside the residence halls. We want everyone to have a good experience and remain safe. Thank you.
Thanks very much, Martino. Just a couple of brief comments for me before moving on to our weekly feature. We posted very recently a COVID-19 in the classroom chart. That was in response to many suggestions we received about making clear how we notify students and faculty if a fellow class member has tested positive for COVID-19. So please take a look. It outlines with clarity our procedures so you know what to expect. Students who are close contacts get contacted by our case trackers. So you'll be contacted that way, but also everyone else in the class will be told to be on the heads up because there was a positive case. It spells out actions that we take after these notifications as well. And then finally, I want to mention a new hotline we started for COVID-19 questions, the COVID-19 hotline at 734-936-7000. That's supposed to be a one-stop shop that will have a series of menus that will take you to different specific offices or sources of information. So you could report a COVID-19 concern. You can get sent to the university health system for students seeking medical care, or occupational health for employees to report COVID-19 symptoms, etc. So please check out and use this COVID-19 concerns line. So I'd now like to turn things over to Dr. Robert Ernst, who chairs our COVID response committee, along with Professor Emily Martin from the School of Public Health, to talk about response metrics.
Excellent, thank you. So as we mentioned last week, we've been tracking a series of metrics and numbers that look at both how the disease patterns are moving on campus, how our response capacity is looking in terms of public health response capacity, and the medical capacity is looking. From current numbers, I wanted to give a brief report on where we are right now with the numbers we're tracking here at the School of Public Health. So we did, as you can see on the dashboard, and we talked about last week, we did have a recent spike in the numbers. That spike seems to be leveling off on the 7-day average, the case average on campus. As of about September 25th, we kind of leveled off and hit a plateau, and then we've had a decline be in place since about September 30th. So about the last week, we've seen a decline. There are criteria as we calculate what's a plateau, what's an increase, what's a decline. There are CDC formulas in place to do that. So we follow those to determine when we're going up and when we're going down. And so we've been in a decline since about September 30th. We're continuing to watch that and making sure that that holds. You know, anytime we see a pattern, you know, one of the most frustrating things about COVID is that it travels fast when it spreads, but in a person, it might travel slowly. It takes a long time between infection and symptoms sometimes. And so we like to watch these patterns and see if they hold for a period of time. So we're watching that decline and hoping it holds, it continues to hold. At the county level, we also watch numbers of the county. You know, the numbers we watch are the same numbers that we, in partnership with the School of Information, post on mystartmap.info. It's a mystartmap.info for Michigan. And so the county numbers there, we've just recently come under the 70 new cases per million threshold. And as of October 5th, we're at 62.5 new cases per million in the county. And that's been going down for about a week. You'll notice I trim a few days off when I report things. So I was saying October 5th. And the reason, that's where the dotted line is on mystartmap.info. And the reason for that is it takes a few days as we learn about cases, we confirm the information, we're continually updating the information as we find out about it, as we know about it. And so it takes us a few days to be really confident about a set point in the data. And so that's where we draw that line on the map if you go to that website. So, so the decline in the county puts us at, the state grades different risk levels for counties and regions. That puts us at a level C in the county, and you'll see that on mystartmap.info. So we're continuing to watch these numbers. We haven't identified any concerns, meeting regularly and watching our metrics for contact tracing, case investigation turnaround, test turnaround. All those systems are steady and those numbers look good right now. As well, and if any concerns are identified, we'll post more metrics on the narrative as the data changes.
That presentation in and of itself was evidence of how fortunate I think we are in terms of campus response, in terms of having respected and expert, access faculty to our response efforts, the same experts advising the governor, advising our response efforts. In terms of these response metrics, they really do fall into three big categories. And the first category that we've just been spending a fair amount of time talking about is the evidence of increased disease spread, either in the surrounding community or on the campus or near campus community. Some of those metrics that were just outlined, we'll come back to, because that was, I could speak about how we responded to that recently. Some of the other categories that we have been watching are strain on the public health capacity to respond. After a case is found to be positive, labs are obligated to report that information to the county health department. And our relationship with the county health department is a really strong and important relationship. From the very beginning, the cooperation on coming up with shared principles around universal masking and reducing social gathering sizes has really been critical for our prevention strategies. But we also have a really good relationship with them on the back end, so that our county, whether they receive a lab result from a university lab or from a surrounding community lab, do some detailed investigation to determine whether or not the person has an affiliation to the university. And they've developed a special code in their tracking systems to flag them as a university affiliate, primarily students who are seeking testing outside the system. So we have then a shared understanding of those cases, because they will then assign student cases, whether they're detected by our lab or an outside lab, to a university case investigator. Through those investigations, then we can identify close contacts and work within our system to isolate the known positives and quarantine the close contacts to try and keep the community safe. We have developed a contact tracing core for the university that has been very robust and has really provided an adequate resource to stay up with the even recent increase in activity. So those are part of our metrics that we're following is the ability to respond. The third is our understanding of the system from the healthcare delivery side to respond. You know, early on in the pandemic back in the spring, there was a lot of discussion about caseloads in the hospital or access to ventilators and things like that. And fortunately, there has been still relatively low activity in the hospital, at least in our region. I think there's been some observations in some other areas, the Upper Peninsula and other areas that hadn't gone through the initial wave of that activity. But at least now our own hospital census is something that we are tracking, as well as our access to services for assessment, care, testing, and turnaround time for testing for these clinical types of labs. So with the recent sort of mid-September increase in cases that were then detected by the health department, we did a mapping study to sort of realize that a lot of those cases did track towards the fraternity sorority houses off campus. And what we also learned in that process is that there really hasn't been evidence of spread from the campus community or surrounding community into the non-student population, I think is really important. Working with our case investigators and our contact tracers, we engaged the students in those houses, and we're able to really create plans for response for each of the houses, and worked with the health department to assure that that was reliable strategies for isolation and quarantine. And just as of, has been just reported by several others, and I heard from the county health department medical director today saying they're cautiously optimistic about how things are going with that. So that's just the example of how we intend to use these response measures to realize that if we see something happening in a community the size of the university, it doesn't necessarily point to a sort of universal change, but it can be a isolated change that we can then focus in on and target a response. I will add that another sort of strategy that we've been able to develop has been this, been reporting out on what we're calling pop-up testing. I like to think of it myself as sort of cluster buster strategy, where if we are mapping cases that maybe started at a social event off campus and then were detected back in the residence halls, we can see if there's a clustering there, obviously then remove the positive cases and the close contacts into isolation and quarantine, and then do a targeted layering strategy of testing all of the other folks who are on the floor or in the whatever is deemed by the epidemiology team as being potentially at that next layer of exposure. And we've done that now on several occasions with several of our residence halls. And our strategy, since we're getting really good at standing these up, is to do them more preemptively as sort of a targeted approach. So that's been another sort of containment kind of strategy that we've been able to develop.
Rob, were you going to talk at all about the saliva testing program and changes to that?
Yeah, I think this is an exciting development. The evolution of the illness has also come with a really shifting in the understanding of the use case for testing, and our availability of testing has really been changing over time. It's very clear that the imperative of having easy access to testing for those who have symptoms suggestive of COVID is really important, and to isolate those folks promptly. Working with the close contacts and have a medical approach towards testing the folks who are at risk of exposure is really important also. But we are very aware and understanding of the concern about maybe even low-level exposures or even mild symptoms, and it can really cause a lot of reassurance if we have a lower threshold for testing. Until recently, we've had to rely upon the clinical lab to try and channel all of those tests. And we're really excited that over the last couple of weeks, we've partnered with a community-based commercial lab, LynxDx, that's going to be able to increase our availability of testing asymptomatic folks. So we're hopeful that we've been piloting it, as you said yourself, President Schlissel, earlier this week with a test, and find that the collection is easier. We're able to then move the collection sites to different areas to make it just easier for folks to participate. And we'll plan to be moving the entire surveillance program over to the Lynx DX system over the next coming days. I would encourage everybody to sign up for this, because we're also going to be just making it easier for folks to participate and encourage people to do so. These are going to be available for students and other faculty and staff working on campus. The other part of the strategy for the increased capacity is to do more regular surveillance of students living in residence halls. So on a rotating basis, because it's going to be simpler to collect specimens, we can actually go to the residence halls on a rotating basis to try and collect specimens from the residents there. This will be different than the targeted pop-up testing that we talked about before, that we'll still continue to use our clinical lab for. Emily, do you want to talk more about the time frame about the Lynx system, since you've been super involved in the planning for this, and I really appreciate all your work on that.
Yeah, absolutely. So, you know, some of the changes we're making that I think are going to really help get more have tests be accessible, have it be easier to participate in the system. One of the big changes is the scheduling. So with the nasal testing we were using before, we were asking people to go on and book an appointment. And then if something came up, if you had a class run long, if you know, you missed your bus, then you have to go and reschedule your appointment. Now we open just a time window, and you can come to any of our locations during that time window and get a test during the time window we open for you when you get your invite. With that, what comes with that is sort of, I alluded to with these other locations, is we're opening these other locations. So you've got Pierpont Commons is going to be a location that we're going to announce soon, and is opening up next week. So watch for Pierpont Commons locations next week. Also, starting to bring tests to the residence halls, and located in the residence halls. And so if you're signed up for the program and we're coming to your residence hall, just come on down and get a test. So if you live in Bursley Hall, Bursley Hall, we're bringing tests to you. So coming to Bursley soon, we'll be announcing exact dates and locations in Bursley in the next day or two. So watch for that.
Thanks, Emily and Rob. Preeti, you were going to have a few questions and a discussion with them?
Absolutely. And one of the questions I had was just around testing in all the different ways and how it's getting easier to test. And you've sort of touched on that through these different mechanisms. And, you know, Rob or Emily, do you want to just summarize, like, you know, I think people still are confused, like, can they go somewhere to be tested? And if so, how?
Well, we're hoping that, again, that we can make testing more accessible and draw maybe a better line of distinction for, you know, accessing a clinical test if you're having symptoms or worried about an exposure specifically. So that would be for students to contact the health service, either by phone or on our website. You can initiate an evaluation just by clicking a button from the UHS website. We're also going to be using that clinical lab for these pop-up tests. And I don't want to, I'm really trying to be clear about it as we start coming to the res halls for just routine surveillance, that people shouldn't regard that as being a sign that there's been a concern about a cluster there now, since we've been doing that in a couple of cases. So the use of a clinical lab is part of the assessment for an evaluation, and we use Michigan Medicine, their lab for that assessment. And so we've had to rely upon that up until now. So people have basically had to sort of register as a patient and become kind of a patient to get testing. The use of the commercial lab should be thought of as for asymptomatic folks. In fact, those who will come for the testing will be asked to check their responsive blue symptom checker to ensure that they're not symptomatic when they do come for that test. And it should be more streamlined in terms of just the registration and process. We still need people to participate in that front-end registration, because there's a consent step that we have to collect for doing that test. These are not the rapid tests that you hear about sometimes, you know, and The rapid antigen tests are not looking for the virus itself. And we're hearing more about the use of rapid antigen tests because they get the results really quickly, which has certain appeal. But the problem with it is they're less sensitive, particularly for just one-time use. And I think the best example of this is the well-publicized event at the Rose Garden, where they had a bunch of people come to an event, even an outdoor event. You know, they screened them all one time, and the low sensitivity of the test really let a couple of people slip through the cracks, and then in the absence of masking and social distancing, put people at risk. You can compensate for a low sensitivity test if you're able to, for the same person, do it over and over again. But the one-time use has some concerns if the intent is to then relax these other prevention strategies.
So there's two things that Rob mentioned about the testing program I want to highlight. One is that I think it's a great point that as we're basically, we like to say that CSTP is on the move. As we become mobile and move to more locations, people have heard this, you know, it's on people's radar that sometimes you might live on a floor of a residence hall and get alert that say, we would like you to get tested today. That's different. We're responding to something we're trying to shed more light on. This is just, we're getting more mobile and bringing more tests to people. So don't attach that to any kind of larger meaning around that. And the second thing being that you know, testing works when it's layered on top of strong fundamentals. So make sure that the masking and the social distancing stay even with this increased access to testing moving around.
Thanks, Emily. You're singing my favorite song, which is that testing is not the same as prevention. It is important, but it's not prevention. So Rob, I want to switch gears and ask you a question. And you know, when COVID is finally over, I won't miss COVID, but I'll miss you. I'll miss working with you, and we'll have to have a date night or something, you know, because I'll miss you. But you know, one of the things we share besides you know, just the COVID and being in internal medicine is that we're both Michigan parents, and parents have an important role to play in their children's lives as young adults. And I'm just wondering if you have some general advice on how parents can best support students during this especially difficult time.
Let me start by saying I couldn't be more fortunate to work with the experts that I get to work with every day, whether that's in student life or in the COVID response. Certainly the university leadership has been very supportive of this work. I feel really privileged on that. So thank you also for the comments you started off at the beginning. Your initial comments I thought were really, really helpful. I do have two college students, one who's a University of Michigan undergraduate student, and she wants some Michigan experience. She loves the university like I do, and she understands that it's not the same university experience that she was expecting, but is found her people, like you say, and she's staying with her people, and she's being careful. And she's also taken this time to try and figure herself out a little bit more. And that's something that some of the health and wellness units can try and help with. You know, I really appreciate the plug for wellness coaching earlier. You know, wellness coaching that's available through virtual, not in person, but one-on-one coaching to use this motivational interviewing technique to have students think about what their purpose is like, you know, what's going to be, how they want to, you know, figure themselves out. That also allows them to think about this holistic notion of well-being, and there's certain aspects of their well-being that they may want to work on, whether it's their decision-making or whether it's their occupational career planning and things like that. So it becomes a very individualized way to explore their well-being. You know, we mentioned before that all of the student life support resources are available to students, whether they're in a residence hall, living near campus, or even fully remote at another location. This is, as you think about some of the advantages of the post-COVID world, besides our sort of strengthened friendship, we can have this way that we've created a full deployment of virtual visits. You know, I think the health service is not just a testing center for COVID. It still has to manage the many sort of health needs of students in that demographic and age group, whether it's their injury management or other infectious illnesses or their mental health issues. So we're able to manage patients either in person or through now fully deployed virtual visits. And it's really pushed us to get creative with that. The counseling center is not different. You can establish a new consultation appointment with a CAPS counselor online, and you can have either an in-person or a virtual counseling visit. And I encourage students to explore that. One of the really important things that I've observed in my time in student life has been the reduction in stigma for help seeking. And I really want to encourage students and to encourage each other. So that's how I would frame my advice, and I would leave it at that.
Thanks. That's great advice. I'm going to switch gears. This is one of the questions that came in, and I'm not sure, Mark, if you might want to take this on. The recent Michigan Supreme Court decision over Governor Whitmer's use of emergency powers. If the executive orders are left to expire, what will the university do to keep students, faculty, and staff safe?
Yeah, that's a really important concern, Preeti, because a lot of our mechanisms rely on guidance that was coming from the state. You know, fortunately for us, both the city and the county are close collaborators with the university, and they too recognize the importance of rules around the sizes of gatherings and the wearing of masks, et cetera. So the city and the county will be continuing their rules in Ann Arbor, as well as around Washtenaw County. So if and when the governor's EOs expire in these helpful areas, we're covered. We're covered because of this help from our county and our city. And I want to use it as a chance to give a real shout out to our fellow residents of Ann Arbor. Folks in the city have to, put up with all of us in their midst. And I shouldn't say this, we live and work in the city together. But there's been very little transmission between students and folks in town because people are changing their habits and they're being careful and they're going to supermarkets at certain times and avoiding certain places where students congregate. And I recognize that that's a hassle, but I also want to shout out my appreciation for the role of Ann Arbor and Mayor Taylor and the town council, as well as our fellow residents of town in helping keep everybody safe by modifying their behavior as well. It's a really great and important partnership.
President Solicitor, just to add to that really quickly, we do have a standing meeting with our partners in the city and the county and the state to talk about coordination and make sure we're all on the same page. So we've been really benefiting from that partnership.
Thank you. The next question, Emily, I'm gonna have you weigh in on this, and you touched on some of this already. This question was submitted in advance. People tested positive on every floor in Alice Lloyd, so I was just wondering, why didn't the whole building get tested?
It's a great question. So the testing around, when we think about testing like a ring model, like testing around a case, so timing matters. And the specifics of the case matter. So it matters. So a few of the things that we discuss when we discuss stuff like this with the health department to determine if it's the right strategy include what is the timing of the infection compared to the timing of when they were actually in the residence hall? And so that matters. The other thing that matters is there a known source of exposure? Is this somebody that may have already been identified through the contact tracing process and may have gotten infected or the infection became detectable once they were in quarantine? That's a different decision-making process. It's kind of prompts different responses than if somebody had an infection become known when they were not in quarantine and physically in the residence hall. So we look for those connections, we look for the known exposure patterns, and from there, that gives us information to see if ring testing is warranted at that point. And that's something that happens together with epidemiologists from campus, our response group from campus, and then the epidemiologists at the county health department have that conversation together about every case to evaluate whether ring testing is warranted.
Thanks so much. I think 2020 is definitely like the year of the epidemiologist. People didn't know that career existed before this year.
I brought my swag.
Yes, yes. Rob, I'm going to turn back to you. This is something I know we spoke about this morning in one of our committee meetings, but can you discuss at least the beginnings of thinking about students preparing to leave in November?
I think it's a really important consideration. You know, we've already started to map out a strategy for both testing and communication. You know, this actually came out of some of the really good advice we got from the team that President Schlissel assembled of other public health and medical experts that we've got us added to the consideration. So I think that a high percentage of the students living in residence halls will have their contracts up that week before Thanksgiving. And I think that just as we had encouraged folks coming into the residence halls before they come, sort of observe a period of enhanced social distancing, just really being more careful about their contacts and their mixing with other groups. I think that's going to be a really good piece of advice for students before they head back to a permanent residence. So we're going to assemble some information about some guidelines for that. But what we want to do with students is also engage all students to find out what their plans are and how we can help them. So we do anticipate, you know, offering testing for all students who will be leaving into a permanent residence and see how that'll be helpful for them. But we also understand that students may be leaving at different times. So we want to try and connect with students and find out, you know, what their plans are going to be and when we can help with a pre-departure test if that's something they're interested in. And we also want to provide them some information and advice for some not just enhanced social distancing before they leave here, but some advice for them after they get back home and thinking about the others they're going to be around.
Yeah, that's great advice. And I know that we'll have some more thoughts on this because I know families will be anxious as their students come back. And, you know, frankly, there's not a way to just fully integrate back without using some of the measures like masks when you're mixing with your family, at least when you first get back. There's a question that came up, and I'm going to post this one to Provost Collins. What do you think will be the best way that U of M can work together to ensure that there will be a smooth transition into the winter semester? And are there plans to have a fully remote semester for winter 2021?
Thank you. I'm happy to discuss that briefly. So we're certainly open to making some changes in terms of how we do the academic part of the university's mission. And we'll be announcing formal plans no later than November 1st. Of course, we always have to be able to pivot if the public health indicators suggest a response that would take us in a different direction. But I really like the question about how do we work together to ensure a smooth transition. I think one of the most important ways to do that is by sharing understandings and the experiences that we've had all across campus. There's so many different types of programs, and the experience that different faculty and groups of students have had with the way that they have actually done their instruction is really informative for other groups. We saw that in the all chairs discussion. We broke people up into discussion groups, and so chairs were talking with people from very different schools and colleges and departments, and there was a huge amount of learning and understanding and finding ways to do more of that as we make decisions. So we're going to be reaching out and gathering input, some centrally, but also from the individual schools and colleges, from faculty and students and staff. What are they actually experiencing? What's working well? What isn't? And how then do we make some changes? We're going to continue to recognize, first of all, that even if we were fully remote with our classes, a lot of our students would still be in Ann Arbor. That for some of our students, that being able to be in our residence halls really provides the best place for them to continue with their academics. And then our programs are hugely different, and there are some types of instruction that really can only be done or done best with some type of in-person. So balancing all of those and working together is how we're going to move forward and make those decisions for the winter.
Thank you, Susan. And boy, a lot might happen between now and January, and I think, you know, we're anxious about the weather, but we're also hopeful about potential vaccines and therapeutics, as well as different ways to test. The next question I'm gonna send to Martino, because this is also a very important question. What are the options for students who are unable to return, quote, home? given whatever their circumstances might be, and whether that's Thanksgiving or in December.
Yeah, so just as we did in March when we shut down, there will be students who, for a variety of reasons, whether it be their own personal situations, whether it be they're from a different country and they can't get back home, we will certainly provide opportunities for students to stay. It'll be by request and review, but in most cases, the review won't be very complicated. Typically, we can have 50, I don't even know how many students, but we can have a number of students that are still here, and we may move them around and so that we have them, in the appropriate spaces on campus, but we will certainly make way for students that need to stay, and we will accommodate those requests for sure.
Now, there was a request to restate the hotline number. I think I got it. It's 936-7000. Yeah, obviously 734. I know that because that's the hospital prefix, so I know it well. But and I will make sure that it's displayed widely. And again, that's for all concerns and questions related to COVID on campus. Okay, I'm going to move on. I wanted to just follow up on Martino's question again. This is, I'm sorry, I'm having a little trouble reading this. So again, just those comment here about the COVID concerns reporting line. Community-based public health concerns can be addressed by the system. And again, this idea of law enforcement as a first response.
Lonnie, I can help with that if you'd like.
Yeah, please do.
Yeah, so the COVID concerns line has been a really popular feature of our public health informed semester, where students or residents in the community can call. The call goes to the command center, the emergency operations center, and it's staffed with individuals who can respond to reports of unsafe behavior, large gatherings, and it provides an opportunity for us, if we have the phone number of that residence, to reach out and alert them that they need to make some changes. And the goal is to have a response mechanism. And then it also allows us to track those situations and also to provide accountability measures if warranted, whether it be warning letters or possibly situations that might go to Oscar. So that line has been used often by not only residents in Ann Arbor, but also students. And that phone number—
I apologize, we may have created some confusion. There are actually two different phone numbers we're talking about. The one that Vice President Harmon just mentioned, the COVID concerns line, is used by people who are reporting behavior like a loud party in town, or a group that looks too large, or a group of people not wearing masks in a front yard, that kind of thing. And that's that number 647-3000. The number I introduced and Dr. Malani reiterated, this 734-936-7000, is a number for all different kinds of concerns that will send you to the right place. It'll send you to the concerns line if you want to report a loud party with too many people, but it'll also send you to University Health if you're a student feeling ill, or to our EHS colleagues if you're a faculty member that's feeling ill, et cetera. So it's sort of like a triage line. Both numbers are listed up on the website as well. Sorry for the confusion.
Yep, no, thanks for clarifying. I guess the point is that when you're not sure, reach out, you can call the hotline. It's gone quite well. I know I've talked to Rob a little bit about how that's working, and people on the other line are quite knowledgeable, and they'll get you to where you are. So I know we're getting close to the end here. Mark, I may maybe turn it over to you for final remarks.
Well, just to focus back again on the fraternities and the sororities, many of them are trying their very, very best and actually working hard to stay healthy, to have a good semester. And if somebody does get ill, to cooperate with case investigators, with county health folks. There have been rare exceptions. So I don't want to make it sound as if the entire Greek life system is uncooperative. That couldn't be further from the truth. And they're all, even the fraternities and sororities that ran into difficulty, they all recognize how important it is to stay healthy in order to have a good semester. And they're all cooperating or increasing the levels of cooperation. Basically, we all want the same thing. We want to be able to study or teach or do our research. We want to see our friends. We want to have a life, and while at the same time staying healthy and feeling safe. And I think our community really does have a shared bond about this. And the most I can do and say is encourage everyone to work together. The pandemic isn't anybody's fault, and it isn't because of bad behavior, and it's not because the university is trying to educate people or because people are living in town. It's a pandemic, and our job is to try to make our environment as safe as possible for people to be able to go about their lives, because of the pandemic is going to be with us, for a while to come. And I think everyone is doing a good job. I am not happy that there have been hundreds and hundreds of cases, but we're trying to control those. We're heading in the right direction right now, but it requires continued vigilance. And we'll make it through this together. We're learning as we go. We're collaborating with everybody contributing, including the folks on the screen, but the tens of thousands of people in our community. I'm confident we'll make it through this and be a strong university and a strong community on the other side. So thank you all very much. We'll be back again next week. We'll take questions that came in that we didn't get to, and we'll put them into groups and answer them up on the web. Have a good weekend, a safe weekend. Have a great next week on campus and in town. Thank you all very, very much, and please go blue.